What if I told you that something millions of men do in private could be dramatically affecting their prostate health? The answer might shock you because it's likely the opposite of what you've always believed. Today, we're cutting through the myths about masturbation and prostate health with evidence that could change how you think about your daily habits. If you've ever wondered whether what you do behind closed doors helps or hurts your long-term health, you'll want to hear what medical science has discovered. Welcome back to the channel where we tackle important health topics with honest, evidence-based information. Today's video covers an adult topic from a medical perspective. We've consulted medical research and expert urologists to bring you accurate information about masturbation and prostate health. By the end of this video, you'll understand exactly how your habits might be affecting your long-term prostate health. This information could be vital for making better health decisions. So let's dive right in. Before we talk about how masturbation affects the prostate, let's understand what the prostate actually is. The prostate is a small gland about the size of a walnut located below the bladder in men. It produces fluid that nourishes and protects sperm. This fluid makes up about 30% of semen volume. As men age, the prostate often enlarges, which can cause various health issues. Prostate health matters to men of all ages, not just older men. While problems become more common after age 50, establishing good habits early can impact your health decades later. There are three main prostate conditions that affect millions of men worldwide. Benign prostatic hyperplasia, or BPH, causes the prostate to enlarge and squeeze the urethra, making urination difficult. Prostatitis is inflammation of the prostate that can cause pain and urinary problems. And prostate cancer is the second most common cancer in men globally, affecting about 1 in 8 men during their lifetime. Warning signs of prostate issues include frequent urination, especially at night, weak urine flow, trouble starting or stopping urination, painful urination or ejaculation, and in more serious cases, blood in urine or semen. If you experience any of these symptoms, it's important to consult a doctor rather than self-diagnosing. Masturbation has been surrounded by myths for centuries. In the 1800s, doctors claimed it caused everything from blindness to mental illness. Religious and cultural beliefs often portrayed it as sinful or unhealthy. These ideas weren't based on science, but they've shaped how many people think about this natural behavior. Even today, despite better education, many men feel shame about masturbation. This shame has made it difficult to have honest conversations about potential health effects. When topics become taboo, misinformation thrives. Some cultures still teach that masturbation causes physical weakness, hair loss, or even infertility. None of these claims are supported by modern science. The psychological impact of this shame can be significant. Men who believe their natural urges are somehow harmful may experience anxiety, depression, or relationship problems. A sexual wellness approach recognizes that masturbation is a normal part of human sexuality for most people. The real question isn't whether it's good or bad morally, but what effects it actually has on physical health, specifically the prostate. Now for the evidence. Several major studies have examined the relationship between ejaculation frequency and prostate health. The most famous is a Harvard study that followed almost 32,000 men for 18 years. This study found that men who ejaculated 21 times or more per month had a 33% lower risk of prostate cancer, compared to men who ejaculated 4 to 7 times per month. This finding held true regardless of whether ejaculation occurred through masturbation or sex with a partner. How might frequent ejaculation help the prostate? Scientists have several theories. The prostate's job is to produce fluid for semen. When you ejaculate, the prostate flushes out this fluid. This might help remove potentially harmful substances that could otherwise build up in the prostate ducts. Think of it as regular maintenance for your plumbing system. Keeping things flowing prevents blockages. Another theory involves hormones. Ejaculation affects levels of hormones like testosterone and DHT, which influence prostate tissue growth. Regular ejaculation might help maintain a healthier hormonal environment for the prostate. There's also evidence that ejaculation reduces inflammation in the prostate area, which could lower cancer risk over time. Interestingly, these protective effects seem to vary by age. The strongest benefits appear for men in their 40s and 50s. For younger men, the connection isn't as clear, while very elderly men show mixed results. This suggests the relationship between ejaculation and prostate health might change throughout life. Before you make any lifestyle changes, we should note some important limitations of the research. The studies show correlation, not necessarily causation. This means frequent ejaculation is associated with lower prostate cancer risk, but may not directly cause it. Men who ejaculate more frequently might have other healthy habits or genetic factors that explain the difference. Prostate health is affected by many factors beyond sexual activity. Diet plays a major role. Tomatoes, green tea, and foods rich in omega-3 fatty acids have shown protective effects. Regular exercise, maintaining a healthy weight, and avoiding smoking all contribute to prostate health. Genetics also play a significant role, with family history being one of the strongest risk factors for prostate cancer. Some studies have looked at whether masturbation and partner sex have different effects on prostate health. Most research suggests the physical effect of ejaculation is similar regardless of how it happens. However, partner sex involves additional factors like emotional connection and physical exercise that might provide added health benefits. Current research has limitations. Many studies rely on men self-reporting their ejaculation frequency, which isn't always accurate. Long-term studies following men from youth to old age are rare, and ethical considerations make it impossible to conduct true controlled experiments on this topic. These limitations don't invalidate the findings, but they remind us that science is still evolving in this area. So what does all this mean for your personal health decisions? For men in their 20s and 30s, there's no clear evidence that masturbation frequency significantly impacts prostate cancer risk. However, establishing comfort with your body and regular self-checks can help you notice changes early. For men in their 40s and 50s, research suggests more frequent ejaculation might offer protective benefits against prostate cancer. This doesn't mean you need to reach a specific number, but regular sexual activity, either alone or with a partner, appears beneficial. For men over 60, particularly those with existing prostate conditions like BPH, the picture is more complex. Ejaculation might temporarily relieve some symptoms but could aggravate others. At this age, it's especially important to discuss your specific situation with a healthcare provider. Regardless of age, there are warning signs that should prompt a doctor visit. These include pain during ejaculation, blood in semen, significant changes in sexual function, or any of the urinary symptoms we mentioned earlier. Don't let embarrassment prevent you from seeking medical help. Doctors are professionals who have heard it all before. Masturbation is just one small part of prostate health. A holistic approach includes eating a diet rich in fruits, vegetables, and healthy fats while limiting red meat and dairy. Regular exercise, particularly activities that strengthen the pelvic floor, can improve prostate health. Staying hydrated, limiting alcohol, and avoiding smoking also contribute to overall prostate wellness. Most importantly, get regular prostate screenings as recommended by your doctor. The American Cancer Society suggests men should discuss prostate screening with their doctor starting at age 50 or earlier for those at higher risk. Early detection of problems provides the best chance for successful treatment. To wrap up what we've learned, scientific evidence suggests frequent ejaculation may reduce prostate cancer risk, particularly for middle-aged men. This challenges older myths about masturbation being harmful. However, ejaculation is just one factor among many that influence prostate health. Diet, exercise, genetics, and regular medical checkups all play important roles. Sexual health decisions are personal. The goal of this video isn't to prescribe a specific frequency of masturbation, but to provide evidence so you can make informed choices. Whatever feels right for you, whether that's daily, weekly, or something else, should be approached without shame or worry. Remember that prostate health isn't something to think about only when problems arise. Preventive care through healthy lifestyle choices and regular checkups is the best strategy for long-term health. Making evidence-based decisions now could save you from serious problems decades down the road. If you found this information helpful, please hit the like button and subscribe to our channel for more evidence-based health content. We cover many important topics that don't get enough honest, straightforward discussion. Leave a comment with your thoughts or questions, but please keep the conversation respectful and focused on the health aspects of the topic. In upcoming videos, we'll be covering other men's health topics, including testicular self-exams, mental health, and heart disease prevention. Turn on notifications so you don't miss these important discussions. Your health matters, and we're here to help you make informed decisions based on facts, not fear or outdated myths. Thanks for watching, and I'll see you in the next video.